I thought I'd start off on Medtronic's business right now. You gave us an update on April 21st. What are you seeing in terms of demand from hospitals, which we know have been hard hit as a result of the reduction in unnecessary or elective procedures, and perhaps they're pulling back from future orders? What is the impact that's having on your business, and how long do you see that continuing?
Well, a number of things. First, it's great to be back, and I also want to congratulate Jeff Martha, who's taking over as CEO, and the transition's going extremely well, and I'm excited about what he can do for the company. But going directly to your question here, obviously, as we mentioned in our recent release, we've had a significant impact in procedures based on hospital procedures going down. But what I want to emphasize is that there are a number of these procedures which contribute to a significant portion of our business, which are actually urgent procedures, not elective. These are for heart attacks, for strokes, things that have to be done, and care has to be given to the patients, without which the mortality rate will increase. And we're actually seeing an increase in mortality rate, which are non-COVID related, because of a lack of heart failure and stroke procedure, amongst other procedures. So we are working very closely with hospitals who are ready to accept those patients. We feel that there's a fear amongst patients of visiting hospitals, and hospitals want to assure patients that if they have an issue, dial 911 and get to the hospital. They need that treatment. And I think that is what we're focused on, to make sure that patients who need care get care. And we're doing everything we can with all our capabilities to address that issue. Hospitals are prepared to take this on, and we have to help them and help those patients get the care that they need. It is extremely urgent. The elective procedures are a little longer term, but the recovery there will happen as well.
It will. You obviously reported U.S. weekly revenue declined about 60% year on year on average. Yes. The rest of the world down 40 to 50%. I mean, numbers of which, of course, I'm sure you never anticipated, like so many other people who run other companies never anticipated. How long do you think the rebound will take?
Well, that's obviously difficult to predict, and almost impossible to be correct about it at this point. We do think that in healthcare, especially the urgent cases, the ones that I just mentioned, the recovery will happen quite quickly. It'll have to. The mortality rates are increasing at a rate that is not acceptable by anyone, and I'm sure that we will work together to address that problem. We just cannot let that happen. So we think in the urgent procedures, which are critical, the recovery will be relatively quick, and that'll happen in the U.S. and Western Europe and other countries around the world. The elective procedures we're working on to also provide sites of care which are safer, to provide hospitals and physicians with capabilities that they can do. That's much more difficult, like I said, to predict, and will probably take a little longer. But the other point I want to make that, Medtronic has a very strong balance sheet. We've got ample cash in hand. We will see through this. We will see through this, and we will emerge stronger and better. And we think that, again, the urgent procedures are the ones that are the highest priority. And then we're working with our physician partners and hospital partners to set up sites of care so that the more elective procedures can also proceed. Remember, they're elective, but they're necessary as well. I mean, no one's doing this for no reason. Right. And over a period of time, that'll become pretty important.
Yeah, no doubt, and very important, obviously, for the hospital systems as well, as we know, which certainly need some help. But Omar, when you're dealing with a lack of visibility as the company's executive chair now, and your new CEO is dealing with that, do you have to pull back in certain areas? Are you continuing R&D at the same level? Are you continuing production at the same level? I know T&E has been cut because nobody's traveling or has come down, right. But how do you approach it, given you just don't know what the future holds?
Well, there are a number of things. First of all, we make healthcare products, and all these products are for patients' benefit, and a lot of these are urgent. So the urgent procedures manufacturing has been maintained at the levels that we had before, because that's what's required. The safety of our employees are critical, so we've got procedures in place to maintain the appropriate social distancing and other procedures. And so in the manufacturing area, we've kept us going at close to our original rates, pre-pandemic rates in most areas. Equally, our salespeople going in and supporting physicians, they're doing that without any compromise at all. Obviously, with the procedures being down by the rates that you talked about earlier, that work is somewhat limited, but our production rates are going at pretty much up there. Now, over time, we might have to reduce it a little bit, but we'll watch and see. R&D we're focusing on to the degree that R&D can be done without having to go to work, that we're doing, and there's a lot of commitment from engineers who want to get the program done through remote work, and that's actually holding quite well. In areas that they have to go into work, where the lab work is necessary and they have to work with each other, we're trying to prioritize that as people return to the workplace, those areas where we can accelerate their graduated re-entry into the workplace so that engineering programs and R&D programs can be maintained. We have a very exciting pipeline in front of us, lots of revolutionary products, in fact, in front of us, which we're excited about launching, about things that will really impact patients, and we don't really want to delay those. The third area is clinical trials. I mean, those have been slowed for obvious reasons. And again, over time, we'll bring those back. But R&D programs are a pretty high priority for us.